I used to believe something that maybe you believe too, that if there's no pain, nothing is wrong. It sounds logical, almost comforting. Pain is supposed to be the body's alarm, right? So if everything feels normal, then everything must be fine. That's exactly what I thought, until I realized that when it comes to your gums, silence doesn't mean safety, it often means the opposite. And the most dangerous part? By the time pain shows up, the damage may already be far more advanced than you imagine. I remember the moment this truly hit me. It wasn't dramatic. No sharp pain, no emergency. Just a small, almost insignificant detail. A little bit of blood in the sink after brushing my teeth. I ignored it. Most people do. After all, it didn't hurt. It didn't stop me from eating, talking, living my life. But what I didn't understand back then is that gum disease doesn't begin with pain. It begins quietly, strategically, almost invisibly. And if you're noticing even the smallest signs right now, bleeding when you brush, slight sensitivity, persistent bad breath, I need you to understand something very clearly. These are not random. They are not harmless. They are signals. Your body is trying to tell you something, before it's too late. Most people wait for a real problem to appear. A loose tooth, severe pain, swelling. But tooth loss doesn't start there. It starts much earlier, in stages so subtle that they're easy to dismiss. It starts when your gums become inflamed, when bacteria begin to accumulate below the gum line, when the tissue that holds your teeth in place slowly starts to weaken. At a microscopic level, colonies of bacteria organize themselves into biofilm, a structured layer that protects them from simple brushing. This is not just about dirty teeth, it's about a living ecosystem forming where it shouldn't. At first, it's just bleeding. Then maybe your gums look a little redder than usual. Maybe they feel slightly tender. You might notice bad breath that doesn't go away no matter how much you brush. And here's the uncomfortable truth. None of that is normal. We've been conditioned to think it is. We've normalized symptoms that should actually raise concern. And that false sense of normality is exactly what allows the problem to progress. Because while you're ignoring those signs, something deeper is happening. Below the surface, your body is reacting to bacterial infection. The inflammation doesn't just stay in the gums. It begins to affect the structures that support your teeth. The bone, the ligaments, everything that keeps your teeth stable. And here's something most people never hear. It's not just the bacteria causing the damage. It's your body's response to them. Your immune system, trying to fight off the infection, releases substances that end up breaking down the very tissue meant to protect your teeth. It becomes a slow internal battle, one where, without intervention, the damage accumulates silently. This is where things shift from reversible to permanent. At the early stage, known as gingivitis, the damage can still be undone. With proper care, the inflammation can be reduced and your gums can heal. Studies in periodontal health consistently show that removing plaque effectively and consistently can reverse this stage entirely. But if it progresses to periodontitis, the story changes. Now, the infection starts to destroy the bone that holds your teeth in place. Your gums may begin to recede. Your teeth might feel slightly loose, not enough to panic, but enough to notice if you pay attention. You may even notice that your teeth look longer than before, not because they've grown, but because your gums have pulled away. And that's the moment most people miss. Because it still doesn't hurt. That's what makes this so dangerous. The absence of pain creates the illusion that everything is under control, when in reality, the foundation of your teeth may already be weakening. There's also something else that makes this progression even more deceptive. It doesn't happen all at once. It comes in waves. Periods where everything seems stable, followed by subtle worsening. This inconsistency tricks the mind into thinking the problem has gone away, when in fact, it's only paused. If you've ever seen a bit of blood when brushing and thought, it's nothing, If you've noticed your gums pulling back slightly, if your breath doesn't feel as fresh as it used to, even after cleaning your teeth, you're not alone. But you are at a crossroads. And this is exactly why we left a practical guide in the first link in the description. For those who are afraid of losing their teeth without realizing it, and want to understand how to identify the early signs before it's too late. Click and see. Because once you start seeing these signs for what they really are, everything changes. You stop ignoring. You start observing. You begin to notice patterns. When your gums bleed more, what triggers sensitivity, how your mouth feels in the morning versus at night. You begin to connect cause and effect. And that awareness, that's the turning point. I've seen how a lack of information keeps people trapped in this silent cycle. They don't know what's reversible. They don't know what signals progression. They don't know when it's still possible to intervene. So they wait. They switch toothbrushes. They try a different toothpaste. They hope it resolves on its own. But without understanding the root of the issue, these actions rarely address what's actually happening beneath the surface. And waiting, in this case, has a cost. Because the longer the bacterial biofilm remains undisturbed below the gum line, the more it hardens into tartar, a rough surface that allows even more bacteria to attach and thrive. At that point, regular brushing is no longer enough. The cycle reinforces itself. But here's the part most people never hear. Even if the process has already started, it doesn't mean you've lost control. Science has shown that early detection and consistent care can slow, and in some cases stop, the progression of gum disease. Proper oral hygiene, targeted cleaning below the gum line, reducing bacterial load, these are not guesses. They are evidence-based actions. Techniques like angling the toothbrush toward the gum line, flossing in a way that actually curves around each tooth instead of just snapping between them, and maintaining consistency rather than intensity, these small adjustments make a measurable difference over time. What matters is timing. Recognizing that bleeding is not just bleeding. Understanding that sensitivity is not just sensitivity. Seeing gum recession as a signal, not a cosmetic issue. And if you've been ignoring these signs without realizing what they could lead to, there's a method explained in the pinned comment that shows exactly how to act while there's still a solution. Because the truth is, tooth loss rarely happens suddenly. It's a process. A quiet, gradual breakdown that gives warnings along the way. Warnings that most people were never taught to recognize. But now you know. And knowledge like this isn't meant to scare you, it's meant to give you back control. Because when you understand what's happening beneath the surface, you're no longer reacting too late. You're acting at the right time. You start making decisions differently. You pay attention to details you once ignored. You understand that prevention isn't something distant or complicated. It's something built into small daily actions. You're protecting not just your teeth, but your confidence, your ability to eat comfortably, to smile without hesitation, to feel in control of your own health again. And maybe the most powerful shift of all is this. You stop relying on pain as your only signal. You begin to trust observation, awareness, and knowledge. Because your body has been speaking all along. Now, you're finally listening. So if this made you look at your gums differently, if you realize that something you once ignored might actually matter, then stay with me. Subscribe to the channel, because this is just the beginning. There's a lot more your body is trying to tell you. And in the next videos, I'm going to help you understand every signal before it turns into something irreversible.